I'm Peter Wiedemann and I'm based in Leipzig, Germany at the University Hospital. Into medicine was never a question. I went into medicine because I am the fourth, I think, in my family to be a doctor. But ophthalmology, I was as a scientific worker in Arizona, and then they searched somebody who knew something about pharmacology in Doheny Eye Institute in Los Angeles, and then I went there and studied ophthalmology, which was a good decision in my life. Well, I came from pharmacology because in those days they said there's no field in medicine where they know so little about pharmacology as ophthalmology, which has changed completely nowadays. But I think the biology of the eye, where you have neural tissue and wound healing, and of course the interaction with light makes it for me very interesting, and the surgery of course is fascinating. Yeah, I met Dr. Ryan nearly 30 years ago when I came as a research associate to the Doheny Eye Institute, and I have never left to work together with him. And when he asked me to be an editor on this prestigious book, I readily agreed. And it was fun to work with this group. Well, I was glad that I could be editor of the surgical volume. I was glad that we don't have a recipe book where you look down bullet point 1, 2, 3, but an academic book. On the other hand, it should be a book which you can use in clinical life and where you can find things which can help you in the treatment of patients. And within surgery, which of course has to be done with your hands, the good thing in this book is that we have videos in addition, very good videos, and electronic update all the time. So I think you can use this book and still it's an academic book where you have complete sentences and an overview of the field. An author I was in previous editions, but an editor, for me this is the #1 book on retina, so it's an honor to be part of this team and to work with Dr. Ryan. It's a great field because you can work, well, first the eye and eyesight is something the people really care for, and it's very good if you can help them to maintain and preserve vision. Secondly, it's a fascinating field in surgery. It combines surgery and more medical knowledge, as we see in the book that the medical volume is thicker than the surgical volume. It has oncology, and you can work on your own and are not necessarily bound to big teams, but still you are part of overall medicine with modern cell biology. So for me it's a very good field, the best field in medicine. It was nice to work with the Elsevier people too. They responded nicely to all questions.